And today we will talk about degenerative disc disease, surgical versus non-surgical options. Hello and welcome. My name is Dr. Devashish Sharma. I am a practicing spine surgeon, and today we will talk about degenerative disc disease, surgical versus non-surgical options. So degenerative disc disease simply means that your disc, especially I'm talking here about the lumbar spinal disc, is losing its normal structure. So basically the structure of anything in the human body is a definitive subject called anatomy. It defines that how anything looks like. So according to anatomy, the disc has primarily two components, the inner gelatinous material and the outside fibrous material. So when slowly you age, the disc starts to lose its hydrous nature, or the water content simply. When the water content is lost, the actual capacity of the disc to act as a shock absorber medium decreases, and that leads to lower back pain. In the advanced stages, the disc starts to lose its height and may even lead to subluxation or the tilting of the spine. Now, it very much depends that what kind of symptoms you are having, which will lead your spine doctor to decide what treatment is best for you. In our practice, surgical options for a lumbar disc degenerative disease without a neurological complaint is almost 98 to 99% a no-no for a surgery, or it's a non-surgical case. In fact, there's a very interesting dictum which is taught to us as a spine surgery student, is that there is no surgery for back pain. The back surgery should always be for a nerve which is getting compressed, or the dura which is getting compressed, leading to symptoms in the hip, leg or the calf areas, but not for the back pain. So the most important thing is to assess that what is leading to the back pain. Sometimes you have a degenerative disc disease which is showing up on MRI, but that may not be the cause of your symptoms. And that makes it very essential that a doctor should work with you, a spine surgeon should work with you to diagnose what is leading to your symptoms. There are multiple ways to evaluate that a degenerative disc disease is leading to the symptoms. There are a few tests which were done very regularly in past, but now a little less common. One is called a provocative disc test, in which they inject a material inside the disc and try to recreate the similar pain by increasing the pressure. However, they do the same thing with an adjacent normal disc also, which may lead to future failure of the normal disc. So the test has become less common. Also, there are another tests in which they try to inject some numbing effect drugs into the disc and see that how is your back pain now doing. So mostly the primary treatment for people who have degenerative disc disease is conservative. And the primary symptoms which patients come to us are basically sitting pain. So people who have desk jobs, they generally complain of severe back pain when they sit for long hours. In advanced stages, people tell us that they have symptoms even when they try to turn sides in the bed, when they try to lift objects, or as simple things as bending forward and lifting weight. Now, all these symptoms have come to you, and they're leading to trouble in your daily household activities. It is very important to go to a doctor and discuss your problems. When these kind of patients come to us, we are the primary mainstay, as I already told you, in our practice is conservative therapy, and we try to give patient at least 6 months of different conservative therapy, which includes the most important: lifestyle modification, strengthening of muscles of the spine, a short course of non-steroidal anti-inflammatory drugs, and also trying to change the food habits. So coming to the first one, lifestyle modification. Say for example, if you have a desk job, we advise that you should start using the standing desk, or do not sit for long hours, and take frequent breaks if you have to sit for long hours, and stretch a bit and then come back to your seat. Second option is to strengthen the core muscles of the spine so that some of the weight which is transmitted by the disc is shared by the stronger muscles which you have built during the core strengthening exercises. That leads to very significant pain relief. The third and the very important thing is lifestyle changes, which includes changing the diet and other things, which leads you to decrease the weight if you have an excessive weight. Smoking also leads to increase in back pain, and we ask our patients to avoid or altogether stop smoking. So if somebody is able to reduce the weight by maybe 10 kilos or 15 kilos and do rest of the things which I have mentioned, all these things lead to very drastic pain relief, and that is usually sufficient for the person to get back into the track and get along with his life comfortably. However, if these things fail and you still have back pain, your doctor would like to take a detailed history, do an exam, and after almost 6 months of conservative therapies, may try to identify the exact disc leading to the symptoms and may give you a surgery option. And surgery options are generally simply two in nature. One is the disc replacement, which is quite famous, but it is slowly going out of favor nowadays, and fusion surgeries are generally performed relatively more as compared to disc replacement, because many studies have told that the disc replacement surgeries have performed very similarly to the fusion surgeries and sometimes have had a little more complication rate as compared to the fusion surgery. In this video, I will restrict my talk to fusion surgeries. So lumbar fusion surgeries are done in different ways. Generally, a cage is put inside the spine, or if you don't have to put, some doctors do not prefer to put the cage and they put simply the bone graft, which leads to the fusion of the two vertebrae, and when the movement goes away, the back pain is usually taken care of. But many a times the data suggests that the pre-operative scores of pain and the post-operative scores of pain after 2 years do not have very considerable difference when it comes to surgery versus non-surgery. Sometimes it's as low as 15% in some of the studies. So that is why one in a degenerative disc disease should avoid surgery unless and until it's a very bad situation. And if you have to go to a surgery, it should be very carefully planned with you and your doctor in very much detail. I have done on multiple occasions, I have done spinal fusion surgery for degenerative disc disease, and it has given very good results in most of the cases. But that is because we try to make sure that we thoroughly understand the problem, do multiple tests to find out the exact reason of the problem, and when we are very clearly confirmed that the degenerative disc disease, and that too very focusedly this specific disc is causing the problem, that dictum comes to us, we have that kind of confidence that this is a problem, we offer surgery, and that is always after failing of the conservative strategies, spinal injections, etc. So that's all about the conservative options and non-conservative options, or surgical versus non-surgical options of degenerative disc disease. I hope I was able to throw some light on how a spine surgeon or a doctor thinks about the degenerative disc disease problem. I'm sure you must be having questions. You can ask questions. I will try to respond those questions in my future videos, or any specific videos you want us to make on. You can give us suggestions. If you like this video, please kindly consider subscribing or sharing this video with your friends. I hope if you are suffering from this problem, you will go to a doctor very soon, and I pray from Almighty that nobody will have to live with the back pain, and everybody's back pain problem should be solved forever. Thank you very much. Have a great day.